Hello! Welcome to another episode of Ask PA Mimi. Get ready, and let's make health make sense. Today, we will be focusing on the topic, Type 2 Diabetes Mellitus, and everything you need to know about this condition. Type 2 Diabetes Mellitus is a chronic metabolic condition, characterized by insulin resistance and relative insulin deficiency, leading to persistently elevated blood glucose levels. It is strongly associated with lifestyle factors and genetics. The causes include insulin resistance in peripheral tissues, progressive pancreatic beta cell dysfunction, genetic predisposition, and lifestyle factors like diet and physical inactivity. The classic symptoms of hyperglycemia are polyuria, which means passing urine frequently, polydipsia, which means excessive thirst, polyphagia, which means increased hunger, TOR. Also note that weight loss may also occur despite increased appetite. Risk factors include overweight or obesity. Family history of type 2 diabetes. Age is typically over 40 years, but it could be younger in higher-risk ethnic groups such as South Asian, African Caribbean, and Middle Eastern ethnicity. Sedentary lifestyle, history of gestational diabetes, polycystic ovary syndrome, and hypertension or dyslipidemia. Signs and symptoms include fatigue, blurred vision, recurrent infections like thrush or UTI, poor wound healing, erectile dysfunction, overweight or central obesity, acanthosis nigricans, and peripheral neuropathy. First-line investigations include HbA1c of more than 48 mol per mole, fasting plasma glucose, or random plasma glucose if symptomatic. Urinalysis to check for glucose and ketones. Second-line or baseline assessment include U and E plus eGFR, lipid profile, liver function tests, urine albumin, creatinine ratio, blood pressure, BMI, and waist circumference. Gold standard investigation include HbA1c for diagnosis and long-term monitoring. Or oral glucose tolerance test may be used if HbA1c is unreliable. To manage your blood sugar at home, you need to take regular meals and avoid long gaps. Have a consistent sleep pattern. Stress management. Adhere to medication. Always remember that. Small daily habits matter more than perfection. Common diet myths in type 2 diabetes include things like diabetics can't eat carbohydrates, fruit is forbidden, honey is safer than sugar, skipping meals lowers sugar, but evidence-based truths include portion control matters more than elimination. Whole grains and fibers slow sugar rise. Fruit is allowed in moderation. Regular meals prevent sugar spikes. Keeping active matters 10 to 15 minutes of walking after meals improves insulin sensitivity. It also reduces post-meal glucose spikes, especially effective after dinner. Morning sugar routines should include check fasting glucose if advised. Avoid sugary drinks upon waking up. Eat a balanced breakfast, i.e. protein and fiber, and morning movement helps reduce insulin resistance. First-line lifestyle management for all include weight loss if overweight, healthy balanced diet, regular physical activity, and smoking cessation. First-line pharmacological management include metformin unless contraindicated. For second-line management, if HbA1c target is not met, add one of the following, like a SGLT2 inhibitor, for example empagliflozin used for cardiovascular disease, DPP for inhibitor, for example linagliptin, phenylurea, for example, glycoside, which works by increasing insulin secretion, and GLP-1 receptor agonist, which is used if obese. Monitoring of HbA1c is done every 3 to 6 months. Annual monitoring will include things like eye screening, foot examination, and renal review. Complications of type 2 diabetes include both microvascular and macrovascular complications. Microvascular complications include retinopathy, nephropathy, neuropathy, and macrovascular complications include ischemic heart disease, stroke, and peripheral vascular disease. Remember that lifestyle changes only supports, but does not replace medication. Never stop medication without medical advice. Also adhere to a good and active lifestyle to avoid these complications. Seek urgent help if symptoms of hypoglycemia or hyperglycemia occur. The prognosis for type 2 diabetes is usually excellent, with good control and complications are largely preventable. Early diagnosis plus consistent habits equals best outcomes. Teams. Thanks for listening and watching, and remember to save the video for future reference. What topic would you like to learn about? Please comment below. Don't forget to subscribe, comment and like for more videos.